Wellness here at South End Pharmacy. I'll be helping host the webinar today and really excited for the presentation we have planned for you all. Next, I'll share a quick little disclaimer in a video and we'll kind of get to it. Just a reminder that today's webinar is just for educational purposes only and is not constituted or suggested for medical, legal, or regulatory advice. I'll just go into it. A little housekeeping. If you notice this QR code on the screen, it is for intake for questions during the presentation, and we'll be really excited to have Dr. Ginsberg present on her presentation today and then answer these live Q&A at the end for all of the providers. For those of you new to South End Pharmacy, we are a Houston-based 503A compound pharmacy, and we're committed to delivering sterile compounded medications. Our reach is expanding, and we are in over 35 states across the United States. And this allows us to provide medications to the patients who really need them and the solutions that they need. Now, I will actually share a little bit about our standards here at South End. We do have a state-of-the-art sterile lab committed to adhering to our USP standards. And the facility is not just a place where we work, it embodies our dedication here at South End. We adhere to strict USP standards of purity and potency, and this means that every compound we create is crafted with the utmost care. We're also Legit Script certified. Our commitment to compliance and integrity in the pharmacy industry, and this certification kind of is a testament to that. Finally, I also want to touch on the fact that we do third-party testing, which is very important in compounding in our industry and builds transparency, but also builds confidence in the outcomes that we deliver for our patients. Now, a little coming soon. We do have some new products kind of in relation to our discussion for today. We'll be releasing a MIC and methyl product here in the coming weeks. And we're hopeful to deliver some of this information in connection with these today to give you some more food for thought and also some more clear practice strategies. Now, I would love to introduce our presenter, Dr. Dian Ginsberg. She is actually board certified in anti-aging and regenerative medicine, advanced fellowship professor for A4M in the Metabolic Medical Institute. She also owns Precision Fem Care, where she takes a deeper dive into treating women's health concerns and understanding each woman's journey to wellness. Her science-based and integrative approach helps patients feel their very best at every stage of life. And when she's not a clinical professor or business owner, she is a triathlete, fun fact. And I am very excited to present her today to our medical providers. So Dr. Ginsberg, I'll let you take it away.
Oh, that's me. I did it. Okay. So share screen. And cool. Can everybody see the Canva? We good to roll?
I think so.
Okay. So welcome everybody, whether you are watching this live or a lot of times my life is so crazy, I sign up to get the replay later. What I'm hoping to do today, I've been in the functional space for probably about 20 years, personal with my kids with their learning problems, which this has been a huge help with. And through the craziness of the Women's Health Initiative, hormone changes, perimenopause, and everything that goes along with it. So what I wanted to do today, one of the big things that I have found is that when patients young and older, so your PCOS and you're then going into your perimenopause and your menopausal women, and even men with their hormonal changes, not quite as extreme as women, but even men, what happens is everybody's kind of quick to grab hormones. And I think we really need to have a little better understanding of what's going on underneath the hood, because we've lost a little bit of what genetics we bring to the party, a little bit of what our microbiome is that we bring to the party from great dinosaur grandma who passed that all down. And whatever our positives are is wonderful. But the problem that happens with aging is whatever our negatives are kind of get augmented. So what I wanted to do is break this down into where we start with a lot of our patients, and steps that we can do to unravel where they're getting into trouble. And yes, definitely hormone replacement down at the end is worth doing, because if you take a menopausal woman, you can do all the metabolic health you want with her. You have to get her estrogen and progesterone where it needs to be. But I'd like to take you through a journey that is going to help you support sort of that trail of patients along the way. So I thought this was a great quote, because you sort of, if you're going to do functional medicine, you have to know a little bit about everything and make sure your patient understands that, because they get frustrated. Well, why doesn't this work? Well, your microbiome isn't great, or your genetics do have a predisposition to insulin resistance, or you do have detox problems. So a little bit of understanding there to get them in place. So what we're going to do is we're going to talk a little bit about epigenetics. I don't want to go super deep into that, but it's a big hot buzzword today. And I think it's important to understand the extent of it, but the extent to the point that we're not born right with our genes as our destiny, that we can support genetic health. And that's where epigenetics and methylation comes in. That's what rolls us into methylation and metabolic balance. Kill the bad genes, let the good guys come forward. What biomarkers do we follow? One of the big things patients do get frustrated with is if we do a zillion tests. So I wanted to introduce sort of a pathway that we follow to travel through. Here's where your baseline problem is, so we know whether we need to go at the gut or go at their genetic methylation problem, or work on stronger detox, and then some clinical strategies that you can use on a day-to-day basis with your patients. So as we know, everybody's complaining we live in a medication-driven world. Patients don't want that. The Surgeon General now, Casey Means, who never graduated residency and some reason is the Surgeon General, turns around and says we've got to find root cause, and we know that root cause medicine and support is what's key along the way. Whether you're an athlete, athletics for me is sanity, and I think it's actually helped me. I'm 60. It's helped me in my menopausal years, especially because it helps with insulin resistance, it helps with detox, but it helps you not only be strong physically, but mentally, and realize that as the system is sort of trying to break down, you can do things to help you get back up again. And whether you're in business or education or medicine or anything, you need as strong a support as possible. Okay. So let's start with a quick case. So here's a 60-year-old female, no period since 52, very stressful job, 2 kids, both with learning problems through their whole life, doing well on her hormones, takes no medicines, just supplements, her omega, her vitamin D, her probiotic. She's active, she exercises, but not only does she have stress in her life and we're giving her hormones, but here's the genetic cards that she's dealt. So her basic genes, right? This is somebody who is fit, exercising, healthy, but has genetic cards that say you have really high risk for obesity and weight gain. Problem number 2 is when you group them together, and this particular gene pathway is from 3x4 genetics. I don't own them. I don't have any financial connection with them. I started to use this in our office because I found for the first time, this is a pretty good, well laid out report. Years ago, we did 23andMe and we tried to put it in Genetic Genie. And I even did some of Ben Lynch's Seeking Health stuff. And you'd get these massive reports that overwhelm patients. 3x4 genetics is very reasonable. They do a pretty good job because they lay out of your 6 main pathways: cardiovascular health, detoxification, mood and behavior, energy mobilization. they lay out a pretty good overview of your strength and your weakness. And as you can see in this particular patient, her appetite is bad. She eats and doesn't know when she's full. So she's got a little bit of natural leptin resistance. Once the fat goes on, what happens is inflammation gathers around it. So coming off of it's a problem. And she doesn't respond well to exercise. This lady is me, which I'm sure you probably figured already. I'm a runner and I have terrible fat burning and response to exercise genetics. What I want it to explain, though, more than anything, is that those genetics in all of our patients, again, will drive us down a pathway and get worse in how it affects us as we get older, unless we can support the system. Compounding comes in, I think, pretty significantly because you can tailor it so well. Whether you're looking at the hormones, whether you're saying somebody needs B12 in a higher dose in an injection, or maybe you can use just a sublingual lozenge. You can really personalize where their weak spots are to support their system. Now, where does this become important, where we look at it from an epigenetic or methylation or metabolic pathway? So this I did a bunch of years ago, and I thought it was an interesting slide to put in because it shows that at 56 years around the sun, you can slow the degradation of your body significantly by watching what you bathe your system in. And depending upon what you brought from caveman times. So I always say my genes are Spartan genes, right? Those fat holding onto genes were great when we had to cross the desert on an apple and then fight the war. Not quite as helpful in modern day society where you're fed 24/7. But if you manage to methylate or appropriately not turn on all of those genes, what you will do is you will slow the insulin resistance and the fat retention. And then with less fat retention, you get less inflammation, less dysregulation of the immune system. So your epigenetic, or the gene with the environmental age, will stay much healthier. And that's really what extrinsic epigenetic age is. I'm going to talk to you a little bit more about epigenetics towards the end of the presentation. And do I really think you need to do this or have your patients do it? I'm not sure. I don't know that it tells us a lot. You know, it was kind of a cool party trick when I first did it and said, oh, my epigenetics are good. But you could argue that if you know your microbiome's healthy and you're doing your exercise and you look at your organic acids and you make sure your micronutrients are okay, it's probably a better spend that way for patients. So you use their lab core values, which I'll show you, and then you work towards improving their weakness. Okay, so who we are is determined by, again, what we bathe our cells and genes in. So let's get body in line. And this is my younger son who has terrible dyslexia, but graduated college and graduate school with functional medicine's health, doing very, very well. And I thought this slide was perfect because no balance is more important than American Ninja Warrior. So Douglas does that for fun. And even at 60, I swing a little bit on the warped wall. So never too old. All right. Here's methylation. Let's talk about cells and what to do for our patients and how we can support them. And I wanted to simplify this so you can simplify it for your patients, so you can tell them what they need to do to maintain their health through this kind of roller coaster that sometimes they'll feel. So the way I think of DNA, the easiest way, is a string of Mardi Gras beads. And the DNA is wrapped around something called histone. So just think of like Mardi Gras beads wrapped around a spool of thread. If the thread spools are tight together, then what happens is you can't get the DNA out. So you can't get the proteins make. You can't get the message across. That's methylation. If you get a space between them and you put this acetyl group, then the RNA can clearly come in and make protein. So that's all methylation is. It's what genes are allowed to express and what aren't. So what the key, and I see this a lot, is that Well, this is my problem. Okay, somebody push my thyroid med up. Or this is my problem. Somebody give me progesterone. I can't tell you the amount of like 30-year-olds that'll come to me that are on progesterone and estrogen and testosterone. If you have premature menopause, it's rare, but it happens. You will have an elevated follicle stimulating hormone in a 30-year-old woman, and that's a whole different conversation. If you have hormonal issues from good old lab or lab core request in that young woman, or have testosterone issues in that man, that is an environmental problem. That is not somebody who needs a pellet or creams or anything else. That is somebody who needs to understand why their hormones have chosen, or their ovaries have chosen, not to do the job. And that's where you got to look at metabolic health. So how do we put this into an understanding? Cell biology is all about the cost of doing business. The entire body is about the cost of doing business. Probably everything is. Your car, your house, standing. It's all physics. Life is definitely math and physics more than biology. So income comes in, and what you need to do is you need to pay for your home. You need to pay to have the waste taken off. You got to pay your property taxes, and you got to keep your house standing on expenses that you understand. In order to get to work and to get around, you need to pay for your car, and you need to keep that maintenance. Again, waste cleanup is important at the end of every day. And then every once in a while, you get some unforeseen expenses come in. Methylation and cell biology is no different. Vegetables come in via dietary folate. Ask your patients how many cups of vegetables a day they eat. Most of them lie and tell you 1 or 2. Half the time it's none. They should be putting 3 to 4 cups of vegetables in every day. They don't have to be raw. They can be cooked. It should be a nice mix. That would be optimal. But most people aren't eating enough vegetables, so they're not bringing enough dietary folate in, right? B9 or folate. Now, what happens from a health standpoint is that you bring the folate in, and there's a long pathway of enzymes that break down the folate until you get to this MTHFR. And I'm sure that everybody on this call has heard of MTHFR, because everybody, patients, think, oh my God, I have that MTHFR and I'm going to die. Remember, this guy's job is to do nothing more than take nutrients and spin this baseline cycle that makes you who you are, healthy, and then create antioxidants. The other part of it balances your neurotransmitters. So in a big picture, you're bringing in income, and you are keeping your house running with waste being taken away and squelched. You are running your central nervous system so you can function with waste being taken away. And you make sure that if the pipes blow up, or you get pregnant and you have to, or want to get pregnant, because we see a lot of infertility, you have to have leftover to be able to pay for that. And miscarriage, preterm labor, I did OB-GYN for 35 years. We hung every med you can imagine. We threw the kitchen sink at these people, and I don't think it did anything. If you had somebody and that baby was coming because that machine said, that mother said, that baby has to come out because I can't stay alive, because I can't afford my house, so I can't afford the baby, they would deliver or they would miscarry. So it's about making sure that your overall system can stay balanced. And mostly you can keep your house standing. So what do? You bring your dietary folate in. Your enzyme, if it is not mutated, will function at 100% using nutrients to enter this methionine or this cycle. If you have a single mutation in this 677, your enzyme just functions at 70%. And if you have a double mutation, it functions at 30 or 35%. It's not always what you bring in, it's what you spend. So you could bring $1 million in a year, and if you go buy an airplane, you're in a lot of trouble. So the whole concept is to spin this cycle with support that is needed depending on who you are genetically and what your environment is. Because when you bring nutrients in and you create SAMe, all you're doing is all of this to keep you alive. You create new DNA, you support detox, you offload hormones, you make choline. SAMe does all of these things. You have to spin this wheel. Simple up here. If you have somebody with a digestive problem, and people don't want to think about that. It amazes me how many people think, oh, if they poop once or twice a week, that's normal. If they're not breaking down that protein, if you're not eating enough protein, they're not bringing enough methionine into the cycle, you can't make SAMe. And SAMe, with its methyl group, is going to turn off those bad genes. So it's really important for you to be able to spin this wheel. Not only that, but as you spin it efficiently, you make glutathione. Glutathione is your big antioxidant, right? That's cleaning up your waste. So the key is to be able to spin. This is what I get from people. Oh my God, I have the MTHFR gene and I'm going to die. What's important to remember is that, again, that it is about spinning this wheel, not that gene. Please, if somebody's got a mutation, do not dump 10 gallons of methylfolate on them. It's not that they may not need a little extra B12. It's not that they may not need a little extra folate, but if somebody's got the MTHFR gene and they're eating 2 to 3 cups of vegetables or 4 cups of vegetables a day, and you have them digesting well, you don't need to throw extra methylfolate on. And one of the things that will happen if you do put too much of that on, the wheel will overspin. Why? Because the body's going to try to get rid of that folate. So now you give yourself a B12 or give the patient a B12 deficiency. Now they're going, I'm really fatigued. Now you got to worry about the B12. So I just encourage the understanding, if somebody comes to you with that MTHFR gene, to be able to turn around and go, okay, this works a little slower, but let's make sure the system's efficient. I've done a bunch of Ironmans. I don't love the bike. It makes me nervous. I'm even training on the bike on the streets. I'm afraid I'm going to get hit. So I was never a great biker, but I was a really good swimmer and I'm a really good runner. So it didn't matter that my bike was a little bit slow. I used to beat all those big biker guys on the run. So as long as you support the system, you're not going to have a problem. So that's what we want to look at. How do we lower the body's cost of doing business? All right, let's understand where it comes from. This every day. A lot of stuff here. And I tried to make these slides kind of sort of do the talk themselves. So if you want to just page through them, you can get the info from them without listening to the whole talk when you go back through this. But we want you to understand that every day in every cell in your body, in order to run your metabolic system, you're creating all these free radicals, all these ugly byproducts that genetically a lot of people struggle to offload, right? A lot of us didn't come from a land paleolithically that was toxic. So therefore, you bring that again to modern day society, and cleaning up that mess we're not great at. But you have to do it every day to run your system. The problem that happens is that as stress increases on a chronic basis, you will make more free radicals. And here's the PubMed paper on it. I included that in the slides because I wanted everybody to know it's not just, oh, stress will hurt, because that's the big buzzword, right? Every time I listen to a YouTube expert that's talking, or I go somewhere to a talk, I'll hear, oh, stress is a problem, and everybody knows that. But I think it's really important for patients to understand how it's affecting them. I also think it's important to understand that I don't know too many people that ever come to me that go, I'm not stressed. Everything's easy in my life. Everybody has it. And everybody's stress is relative. Somebody's having their curtains changed in their house can be traumatic to them just as much as having a horrible death in the family for somebody else. So try not to judge that. I just want everybody to understand that as stress and the internet and the political climate I have from a lot of people, all of that creates such a big difference in creating this wormhole, if you would, of just free radicals and strain on the system. And that will stop that methylation wheel. So that's where support in this becomes important to keep this system spinning. So where does everything go wrong and what can we do to help it? Nutrient deficiencies are huge. And the biggest reason for that is that black and white, people think that if they don't have celiac, that gluten won't bother them. What I want everybody to understand is that anything that is going to create a stress on the system is going to affect the gut to create nutrient deficiencies. Even if your patient is not celiac, doesn't have celiac, if they're struggling with fatigue or joint ache or weight gain issues or sometimes sleep dysfunction, remember, wheat is a non-dissolvable peptide. It doesn't dissolve in water. So what happens is that it will come into the stomach, get covered with stomach acid and not dissolve. So now it enters the small intestine solid. The immune system in the small intestine is going to take a look at that and say, who are you and why are you here? And when it recognizes the grass-fed beef or recognizes the vegetable or recognizes the fruit, it will either absorb what it needs or pass it through to the colon. The gluten change in the wheat is foreign to everybody. You may not blow up like a celiac person. You may not have diarrhea and this, but you're going to react to it. The nanoparticles in processed foods that keep it shelf stable, you're going to react to it. If you are under a little bit of low-level chronic stress and the gut's knotted, the immune system's going to react more. As you do that, what's going to happen is that you're going to rake the gut. Even if there's no issues, you still rake the gut lining every time you eat. But worse when you have stuff that's a little more inflammatory. Now what happens is you got to put that back together, that wall back together. Well, what keeps your gut lining healthy? Glutamine, cholesterol, short chain fatty acids made by the gut bugs, and choline. Well, guess what makes choline? Methylation. So you can see where it's not necessarily about the MTHFR from a metabolic standpoint. You've created a lot of inflammation here. You got to keep rebuilding the choline. And if you genetically have somebody who doesn't methylate well, or they are low in their ability to make choline, there's a gene, PEMT, that makes choline, they're not going to be able to put this back together again. Now what's going to happen is the gut's going to run into trouble and you're not going to be efficient. You're not going to be able to absorb your nutrients. Now you can't spin that wheel. Now, again, visualize. The ovary looks around and says, nutrients are off, gut's upside down. I don't know that I'm having a baby in this mess. Now, all of a sudden, I'm not making estrogen. So they make a little higher testosterone. Now their cycles are irregular. Or they make inefficient hormone balance and now they're estrogen dominant and they start to not feel good. So again, it's a tip in the system. Maybe they need a little bit of B12 shot. Maybe they need a little support from probiotics. So I want you to remember, maybe they need their diet cleaned up more. So I want you to remember that it's what's pushing that system that creates the problem. And here's a handful of things that explain that, right? Modulation of the microbiome composition impacts the metabolic profile and has been shown to alleviate many of the estrogen modulated disease states. Endometriosis, gut bug detoxification, breast cancer, PCOS, brain inflammation. All of this is that balance that occurs or imbalance that occurs that can't get set back in line again. Again, it's not a hormone problem. It's a gut nutrient support system problem that prevents methylation and antioxidants from doing their job. And everything here is all out of PubMed, right? More important as a cancer risk, and everybody, women are just so panicked to breast cancer and promoting factor than the microbiota composition, the bugs themselves, is the functionality, the whole thing. So the microbiota, right, are the bugs. The microbiome are the bugs and their pre and probiotics or their byproducts. So you can see that the diversity and what's in there is determining how well you're creating the bad estrogens in your detox and offloading them. So it goes back to, if you've got a breast cancer risk in your family and the aunts and the mother and the grandmother all had it, chances are their genetics send them down the more toxic estrogen pathway, but I would bet they've got gut problems that prevent methylation from detoxing the system. So it's really important to consider all of that. Simple aging. Great study that was done. So this was done by a lady a doctor up in Colorado. And what she did is she took the LCR, stands for low aerobic capacity. HCR stands for high aerobic capacity. So she took rats that were low aerobic, less fit, high aerobic, more fit, and sham. They were young. The sham group got surgery. So cut them open under anesthesia, looked at their ovaries, closed them back up. The OVX was where the ovaries were removed. So they got their ovaries taken out. And then they closed them all back up, the fit and the non-fit, and they let them all live together for I don't know, maybe 6 weeks. And then what they did is they killed them all. And they looked at the butyrate, the short chain fatty acids, right? So the acetate, propionate, butyrate, but butyrate especially is what's made by the gut bugs to keep the gut lining healthy. So what they found is just losing your ovaries, just aging creates a problem in keeping the intestinal health where it needs to be. So support of that system metabolically and with what we give from the outside world and nutrients and supplements and food really needs to be taken into consideration, because the butyrate's not there. The gut bugs aren't as supported. They can't absorb your B12 from your food as well as they used to. They can't absorb the glutamine and the 32 essential nutrients that you need to live. So aging is just there. And I'm 60. So years ago, when I was 40 and I would talk to patients about this, it was a little tougher. Now I tell them, you're old. I could say that. I'm 60. It's kind of like grandma. She can say anything. So you tell them you're old. This is what's going on. So this is what we got to look at and support. Another thing that comes along, this is so important. Everybody is making a big deal about driving testosterone up. What happens with aging in women is you develop net higher testosterone relative to estrogen. And that is what creates insulin resistant. Why? So what happens is that, and women don't see this, it's very subtle. This is very key for your late 30s, 40s into that menopausal transition, 50-year-old woman. So, and it hits in her 50s too, but this is the person that it really frustrates because she's 46 or 45 and she says, I don't quite feel myself. I'm gaining weight. I'm eating the same food. I'm doing what I used to do. Why am I getting this belly fat? Because in caveman times, when you got into your late 40s or mid 40s and you couldn't have a baby anymore, they pulled you out of the I can have a baby tent and they put you in the grandma tent. And you guys can look that up. It's called the grandmother hypothesis. 4 whales and humans, short fin pilot whale, narwhal, orca, and beluga are the 4 whales that grandma whale takes care of the grandkid, while mom and dad whale do whatever exactly they do to get food. In the human tribe, grandma would watch the kids while mom would have the babies and the hunter-gatherer would go hunt and gather. The problem is grandma's value was less, so she was fed less. So in times of starvation, what would happen is she didn't get as much. So she craved, which is why your perimenopausal, menopausal woman is craving carbs more because they know they're limited what they're going to get. And number 2, with that drop in estrogen relative to testosterone, the muscle cells become more resistant to insulin. You can't get the insulin into the cells as well, so you can't get the glucose in. So now, especially if your genetics are an issue, what happens is you eat, you drive your glucose up in the light of this extra testosterone with lower estrogen, and you can't get it into your muscle. The insulin freaks out and shoves it into fat, and it doesn't want to come out again. So it's really important to have women, again, especially in their perimenopausal years, understand this is going on. That's where metabolic optimization, detoxification, getting the methyl cycle spinning, making sure the microbiome is optimized. That's why those things are so important. And please don't drive the testosterone levels up. the worst thing you can do is drive that woman's testosterone levels up. It's getting the estrogen back in line that actually makes the estrogen, makes the muscle work. And here's just an explanation of that. So again, in your glucose insulin resistance balance, when estrogen is there, it carries leptin into the brain. So estrogen says, we can have a baby, we're good, bring the leptin in. We don't want to get too heavy, we don't want to get too lean, we want to be perfect just to have that baby. We bring glucose into the muscle, we don't let the fat get too inflamed, we keep the immune system in line, and insulin knows its place. When estrogen starts to drop in those perimenopausal and menopausal years, everything goes out the window. Like I just told you, the insulin resistance kicks in. The estrogen's not there to bring leptin into the brain. That's why the certain medications that people use, or women and men are using now, the big negative of weight loss is the cravings, is the food noise, because you're meant to put on weight because you don't know where your next meal is coming from. That's why it's really important with whatever you integrate into your practice that you work with each individual patient to make sure that it's not on med, off med, that there's an exit strategy of understanding the calories and the movement that has to go along with it. The big difference that some people say is that to stabilize a lower weight is easier than to get there because of the food cravings, because of the food noise, because of what the brain and the gut and the body wants to drill into it to stay alive. Why does insulin resistance and weight gain become more of a problem? Because estrogen increases burn and testosterone reduces it in the mitochondria. So the natural state of aging is that you will slow your metabolism. And I just wanted to put a handful of slides in here so everybody could see this is what's going on in the metabolic state and why it's really important that the mitochondria gets supported, that the Krebs cycle gets supported. You know, we get taught all of this in school, and then, right, 2 years of general academics, and then 2 years then as a provider, as a physician at least, then you're in the hospital where you're deciding what you want to do. And now you're a resident, and I'm cutting people open and doing hysterectomies and delivering babies. I can't remember the last time somebody sat down and said, did you review the mitochondrial Krebs cycle? By the time you get out into practice, those things seem to get forgotten. And I appreciate that in functional medicine, because you got to make sure every piece of the car engine's together. Otherwise, turn that key and it's not going to go. So just remember, this is what your patients are losing, and this is where they're struggling. Same thing, I wanted to put a little brain gut axis in to talk about why the gut's so important, because the gut microbiome and the brain are so significantly together. And this is just a study that shows that elevated TMAO creates increased neuroinflammation, along with the natural neuroinflammation that starts with aging, to increase the risk. And you can test for this in Parkinson's and Alzheimer's. So what biomarkers are we going to do? For men, the biggest thing I can encourage is make sure you get a free testosterone, but please make sure you get these free estrogens. Also get their DHEA. DHEA is a really easy way, if it's low, to give them a supplement that will help increase it, and that can help increase their testosterone. I'm just not in a hurry to put men on testosterone right away. You want to support everything you can. The other thing that happens is when blood sugar is dysregulated in men, sex hormone binding globulins are elevated, binds their free testosterone, hence it's a problem. Made a lot of sense, right? Summertime ends, blood sugar's elevated, getting ready to go in the cave. You don't want anybody having babies or doing anything that's going to waste energy. So men feminize a little bit more, right? Binding globulins go up with blood sugar, testosterone goes down. Perfect way to hibernate. Women are the opposite. Blood sugar dysregulates, sex hormone binding globulins go down, testosterone elevates, insulin resistance gets worse, whether it's perimenopause, menopause, and they can't have babies anymore, or PCOS and you don't want them to have babies in the cave. So get their binding globulins, because that's going to let you know if you're running into trouble from a glucose marker rather than, again, just putting hormones on people. so you can get their whole system again a little more balanced. Okay, women just specifically, 2 things to consider. Remember, FSH can still be high and you can still make estrogen. I bring that up from a detoxification standpoint that I want to talk about now. FSH can be low and you cannot be making enough estrogen. So, brain ovary connection, where does this all come from? As we age, it's the brain ovary connection that goes before the ovary itself. The ovary looks up at the brain at 40, 45, says, you're old, I'm not talking to you anymore. And the brain says, you better listen to me. That's why the FSH goes up. That guy will elevate, but the ovary's not dead. It can be roller coastering. So your patient that says, I don't feel good, I'm tired, I got breast tenderness, my belly's more bloated, my periods are heavier, worry, and I'll show you next slide, more about detoxing her before you give her progesterone. Same way, if the system is dysregulated and you're a little bit older, you can have somebody 47, 48 that's got a normal FSH and the ovary goes, I'm doing everything I can, I just can't quite get there. So that person that still may have normal periods, but she's like, man, I got brain fog, I don't feel good, my system's off. You do her micronutrients, you get her metabolically stable, you make sure she's got enough B12, make sure she's got her probiotics, everything in line. But that's the person you want to maybe consider microdosing with a little estrogen and progesterone. And in the future, we'll do a little more detail about that. I'm more interested right now in remembering that you can start to see these perimenopausal changes, but that women can be estrogen dominant. This is where the salivary testing comes in. You can see an estrogen dominant person here, and this is somebody that you want to do whatever 2-week detox or 3-week or 4-week, whatever your detox protocol is. You can see now, I'm going to clean this up and consider giving her progesterone. But my big reason to show this is to worry and say, hey, if she's a detox genetic problem, if she's a gut problem, if she's got some metabolic issues, please support the metabolic system first. Okay, couple baseline labs. This is my thyroid panel. So we get free T4, free T3, along with the TSH, total T4. I get reverse T3. The biggest reason is a normal reverse T3 should run somewhere between 10 and 12. A lot of women and men, but probably I see more with women, when they start to run into this metabolic dysfunction and this detox dysfunction, they will complain of weight gain. And the immediate thing, I'm tired and I got weight gain, has to be my thyroid's a problem. It's the first thing I see. In the rat studies, the number one way that the rats lived longer was calorie restriction. Don't overdo the system. Lower the cost of doing business. That gives you epigenetic long-term health. They did a thyroid study of women and men not on thyroid meds, and they followed them over 10 years. So they were, I think, 50 to 60. Those that lived the longest, less coronary artery disease, less heart attack, had a low free T4. They followed another group of overweight men and women over a 2-year calorie restricted. I think they restricted them maybe 20%, and they gave them diet, help, and exercise. They followed their BMI, their sugar, their insulin, and their free T3. The ones that lost the most weight had better insulin and less blood sugar, had a lower free T3. The animal that lives the longest, I think, in our world is the naked mole rat. No eyes, no hair, underground. It's got a low cost of doing business. I don't know why out there. The big thing is run the thyroid level elevated, run the T4 at 2.7, run the T3 at 5. It's wrong. It's wrong. You don't want to push the mitochondria. You don't want to elevate the thyroid. You want to keep it at a medium to low level so you run an efficient cost of doing business. You want to make sure that your gut's in line. You want to make sure your C-reactive protein's not elevated, and you want to look at your glucose insulin numbers. That is metabolic health 101. You want to look at your gut, because microbiome dysfunction is going to give you anxiety and insomnia. So again, it's not automatically about giving progesterone. If I'm in this kind of late 30s, mid 30s, early 40s, oh, is my hormones a problem? Remember, If the gut's not where it needs to be, women will have hormone dysregulation and men will have blood sugar problems and lower testosterone. The body won't make testosterone in men. It will convert it to estrogen when blood sugar is dysregulated. So you can push that testosterone up in supplements or in medicine, and he's just going to convert it to estrogen. That's why I want you to make sure when you get your male testosterone, you get not only the free and the binding globulins, but you get those 3 estrogens to make sure there's no conversion. And then look at his gut. Digestion, important. Just ask. Bloating, very simple. Digestive enzymes, whatever company you like to use. I think most of us run into digestive dysfunction probably in our mid-40s. We could probably all benefit from a digestive enzyme to help bring in the nutrients to support methylation. Again, always try to support it with food, but we move to whatever we need, whether it's supplement or injection, depending upon how we feel. And 4 things you need to keep the gut healthy, right? Motility, secretory IgA is your immune system, fat digestion, hence digestive enzyme and good reasonable fat in your diet, balance of the immune system, and microbiome diversity. The more different bugs you have, which comes purely from varying your vegetation. Again, some of this is common sense, but I bring it up because a lot of people forget it, and it's really important to go back to this in metabolic dysfunction. The correct probiotic, I wanted to do 2 minutes on it because a lot of people have a lot of questions about this. So yogurt, kombucha, the things you're buying off the shelf, the probiotics or the bugs themselves are in there. It's what they have produced is prebiotics. So when you drink kombucha, the prebiotics are going through the stomach acid into the intestine. Some of the bugs will survive the trip, most won't. So when you drink kombucha, you're giving the body bug food. You may be giving it a little metabolite also, depending upon what they made in the kombucha. But it's mostly to support the bugs that are in your gut. Probiotics are capsulated bugs. They do not have to be refrigerated. Everybody makes a big deal out of that. Companies that like Ortho and Designs for Health and Thorne, those multi-billion-dollar companies, they have a capsule that can keep the probiotic shelf stable. So it doesn't have to be refrigerated. It's kind of like almond milk. They put it in the refrigerator because everybody thinks it's better. There are no spores naturally in your gut. Spores would come in after the long winter in the cave. For the most part, it's a mix of Lactobacillus bifidobacter that you're going to use in your probiotics. If you have somebody with a dysregulated gut, often what we'll do is kind of clean their gut, pull the gluten and dairy, make sure that they're working on their stress, and give them maybe a month or 2 of spores, because the spores are going to go in, elbow the bad guys out of place, and organize the system like they would coming out of the cave. And the probiotics then you go back to will take over. And if everybody's happy, we make postbiotics. That's what your bugs make in your gut. So a couple things just to finish up, a couple things to check. Talk to your patient. Not married to any particular lab, but this is where you look at your missing nutrients. First place to go metabolically. Some people like SpectraCell. Some people want to use NutriVal. Some people like more of the organic acids. They're all good labs. You're looking at what's the big missing. You're changing their diet. People have to focus on that, and you add supplements as needed. You're not only changing their diet, you're maximizing their gut optimization. Otherwise, they're going to spend hundreds of dollars on supplements that they won't absorb. I know you guys probably all know that. Okay, what do I think about long-term biological age testing? I think it was really cool. It came out a few years ago, and everybody's still talking about it. I don't know that there's anything you can do with the test. True Diagnostic now, supposedly their omics test will tell you, well, you know, you can be low in urolithin A and you can be high in this. It gives you a lot of data there. Are you going to be micro managing where now your patient's on 800 pills? I think so. So I just would be very careful. The big thing I want everybody to understand is that this paper will tell you that biological age can actually vary as much as 5 years in a day. So any study that you're even reading where you want to see if a therapy works, it's got to be like a 7, 8, 9 year difference, or it's just standard error. So do I make patients do that? I think the test is expensive. I think it's a cool test. I don't know that there's a lot to do with it. I'd rather have them do a microbiome test or a micronutrient deficiency or something along those lines, or pay for their little better food. Or a lot of women especially pay a trainer because they don't want to lift. So I'd almost rather have them do that. So just remember that there's a ton of different clocks out there, and it's just interesting to take a step back and keep your eye on it. But at this point, do I think your patients need to do it? I don't know that it's going to make a major difference. Longevity clinics are really doing it. And those are people that they're doing ozone and this. And again, I'm not against it. I just think if you're stacking it on what your patients should do, I think you figure out the problem and you treat their metabolic dysfunction. Here's pace of aging. It's a little cheaper, and it'll show you how many times you, like how many birthdays, I guess, you have a year. So this was my Dunedin pace. So theoretically, I age for every year that the average person ages, I age 0.7 months. Again, it's going to show you that what you're doing is correct. But I almost think that if you do all the other stuff and get people exercising, you're going to slow your pace of aging anyway. Physical activity, please make a copy of this and show it to your patients. No metabolic support of anything is going to mean anything unless they're lifting 2 to 3 days a week for an hour and doing low-level cardio. Aerobic fitness from Phil Maffetone, who's a big cardio marathon guy, will tell you 180 minus your age. So real good way when you're talking to your patients, especially women and men that want to just walk, it's not getting cardio enough. So use 180 minus their age for where they need their heart rate to get into the aerobic zone to burn fat. And just an FYI, this doesn't work. The wrist is very inaccurate. If somebody really wants to track their heart rate, they have to wear a chest strap. So the Garmin or the Apple Watch will talk to a chest strap. That's how you really monitor your heart rate. But you really have to do this, especially in people that want to stay healthy and fit. And you got to combine it with hormones, period. Like when I start women on hormones, they're like, oh, is this going to make me lose weight? It's going to help reverse the insulin resistance, but you have to put the time in. So spin the wheel. Make sure you keep your cost of doing business low. And I thought this was a really cool article. I end a lot of my talks with this. It's an old article, but it's pretty cool about a young woman who was just nutty, stressed, all over the place. And this was from Outdoor Magazine, and she slept outside in a tent. The only thing she had was her phone to use as her alarm in the morning. And it was fun. It's a funny story. And I heard the birds and the bugs, and I was creeped out, and it bothered me. And then I couldn't sleep. And then the next night she slept without a problem. Then the next morning she didn't even need an alarm to wake up. And by the end of the week, she didn't need coffee. So it's interesting, right? What a restless coffee drinker learned from going to circadian rhythm rehab in the woods. So I just think it's important to realize that some of that woo-woo stuff to integrate really makes a big difference, and to just make sure you go under the hood to look at all that metabolic support before you start putting that other stuff on top. And I'm happy to take any questions.
Thank you, Dr. Ginsberg.
Right.
So great. So many things to consider before we end up seeing those deficits in some of our labs. We did get some really great questions. We'll kind of put those up and I'll prompt you. What was the name of the genetic test?
3x4 genetics. 3x4 genetics.
Okay. All right, Carlo, what else we got? What are some of the recommendations to start to restore gut function in your patients?
Really easy, really easy. Kill gluten 100%. Make a little gluten sheet of what they can eat instead as a treat. So I kill that because everybody has a lot of inflammation from that. I tell them to decrease dairy a little bit, but mostly kill gluten. I use transformation enzymes digest. I think it's a really good digestive enzyme. It's tolerated easy. I use that once with each meal. And I use probiotic, and I don't care who you use. Ortho, Designs for Health, Transformation, Metagenics, in other words, any good probiotic. And believe it or not, make sure that their vitamin D is therapeutic. And I'll tell you why. You'd be surprised. It shocks me the amount of people. That's why I put vitamin D in the thyroid. The amount of people, I would say probably 50 or 60% of the people that I check their levels, they're still under 30. And here's what's really interesting that you'll see, and I actually have this gene also in the 3x4 test. There are people, there are some of us that actually have defect on the vitamin D receptor. So we don't get the D into our cells well. So you take that person and you run a vitamin D of 30 or 35 and LabCorp says it's okay. They're not getting enough into their cells. Their cells think it's winter. The mitochondria think it's winter. The metabolism just doesn't work well. Now what happens is they don't feel good. So when the mitochondria doesn't work, how are you going to stay alive? Sugar. That's where you start feeding sugar. It's where the cravings and stuff come from. Now that sugar goes in and now the blood sugar is more dysregulated and you have that problem. So before you do whatever gut test you're doing, Vibrant or GI Map or whatever it is, I tell people omega D probiotics, that's my basic, and add digest by transformation enzymes, kill the gluten and dairy, and they'll feel like a new person.
Excellent. Okay, what detox plan do you recommend, and when do you reintroduce dairy and gluten, if ever?
So my favorite detox is the Designs for Health Paleo Cleanse. And I like it because it's easy. People get so overwhelmed. And what am I going to, it comes with a book. It's not calorie restrictive, so they can eat all the food that they want. The little 4-page book that comes with it says eat all these good meats and you can eat these vegetables. You can have some potatoes. You can have some fruit. So it walks them through that. They can eat 24/7 if they want. They don't have to worry about it. And all they have to do is they do a pill pack of 4 pills and a powder. And if they're a smoothie person, they can just put the powder in it. It's not meal replacement. So in other words, they get up, I tell them, and drink your little powder and then have your 4 pills and then have whatever your food you want. But they're killing the bad stuff and they're adding this flush through the liver detox. They're pushing the COMT and the MTHFR. They're pushing all of that. With it, it will kill gluten and dairy. If you do that and that person feels better, you tell them stay off the gluten and dairy forever. There's no reason to go back. Why? Because when they go to a wedding, tell them have a piece of cake. The gluten's in that. It's not a problem. But when they cook at home, if their gut can't tolerate that peptide, tell them they can make a cake out of Simple Mills or I'm trying to think. There's a bunch of dairy-free ice creams. I eat Bobo bars before my run. It's an oat bar. It's got carbohydrate in it. We're not telling people they can't eat some kind of carbohydrate like this. It's just that peptide's a problem. But again, if they go to a birthday party or they go to a wedding, they don't have to have a panic attack. They should just limit it. And if they start to live that life, then they're eating more whole food anyway. When people say to me, oh, I did paleo before it was too hard. Eat real food. It just goes back to basics. So if you get better off of that, that's Mother Nature and your gut telling you that your tribe didn't eat it.
What nutrient tests do you prefer?
We
or
go back
utilize?
and forth. We go back and forth with organic acids and SpectraCell. I like SpectraCell. I always did. I've known them for 100 years. The problem is if you're doing anything out of state, if you're doing telemedicine, it's really difficult to get the blood drawn, to get it shipped in, to not. So if you've got somebody local that can go and you're just looking at nutrient deficiencies, I think SpectraCell is good. We use Doctor's Data organic acids for everybody else. And the biggest reason I think we use that is because you're sort of getting a big picture. So you're looking at nutrients, but you're also seeing, hey, your gut metabolites are a little bit of an issue. You know, the stuff in your Krebs cycle is a little bit of a problem. I liked the NutriVal, and we used to do a lot of that. We had a lot of trouble with Genova. The test is expensive. They would tell us patients would only have to pay this, and then I had people use their flex spending, and then somebody would, the company would take $5,000 out of this flex spending. So I thought the NutriVal was a pretty good test, but it's also a little overwhelming. I try to give so much data to patients, and patients are like, I want this data. But then I find half of them, like 10 minutes into me talking to them, they're on their phone texting. So it's, or something. So my issue would be if you've just got a pure nutrient problem with a Texas person, do SpectraCell if you can get it easy. Otherwise, just do the organic acids, the doctor's data organic acids. It's simple, it's reasonably priced, and it gives you really good data.
Okay, and then what else we got here? Oh, the feed was cutting out. Where can I review these? So we will actually post the recording to our YouTube and share with all the registrants after this presentation as well. Salivary testing, which company and which panel do you recommend?
I use Access because I think you get the biggest bang for your buck. I think the problem with ZRT is that he doesn't use estradiol and estriol. I mean, estrone and estriol. And I use the estriol estradiol ratio in the saliva to come up with my biased combo, which I will be happy to. I'll talk to Haley. We'll do another talk on that. But I use that to look for estrogen detox. And now I know where that person is. I can get a cortisol from it. I can look at their progesterone. So I'm good for my perimenopausal women. And the really good thing about that, if then 2 years down the road, she turns around and now she's having hot flashes and doesn't feel good, and I run her LabCorp or her Quest stuff and her FSH is up and her estradiol is down, and I know I have to give her hormones, I don't make them respit because I'm only interested in how they ran that ratio. So I run their biased based on that estradiol estriol ratio, and then down the road I do a 24-hour urine to monitor everybody. You can't, and we'll talk in the future, you can't use saliva to monitor hormone replacement. You'll get messed up results that are too high. You'll get overrepresented results. The saliva absorbs more than the brain does.
How do you treat parasites in the gut?
We use a lot of, and Sheila, Vuchkovich, who is my nutritionist, is probably a better answer for this, but I can tell you that we use Cellcore. We use a lot of the Cellcore products. She uses para something in Cellcore and their lymph drainage. She'll do their phase 1, phase 2, and it's easy. It's a little expensive. Is probably the biggest complaint that we get, but it's laid out, it's easy. I think it's para 1, para 2. I use their ATP every once in a while with their mineral complex, just kind of before a marathon to support the system, but we use the Cellcore stuff.
Okay, and last question that we got in, can you repeat the name of the enzyme in the probiotic?
So the digestive enzyme that I use is transformation enzymes. They're digest. And if you have a patient with a really delicate gut, they make sort of a wimpy model of that called digest zyme. So you can sort of start them real gentle. And probably most of the time we use orthomolecular's probiotic. I use orthobiotic. It's got good lactobacillus, good bifidobacter, and it's got a little Saccharomyces boulardii in there to keep the C. diff in line. They make orthospore, but we probably use megaspore, microbiome's megaspore, if we're going to use spores to kind of get the bugs back in line. But most people do really well on the basic orthobiotic. And Thomas Williams, who's their PhD, I actually asked him that question, what is the best way to treat the gut? Because they make both products, so they don't care as long as you use one of them. And he said there's no spores ever in the gut unless you were coming out of the cave. So therefore, in general, you want to use the Lactobacillus bifidobacter. And then if you've got somebody that's upside down, you give them a couple months of spores and then get them back in line again. But if you have I don't think that Designs for Health's probiotic is a problem. I don't think Zymogen's bad. If you really honestly look at the back of them, they probably all have the same thing in them. They're a Lactobacillus bifidobacter mix.
Thank you so much, Dr. Ginsberg, all of your questions and insights and getting started in all of this. We'll look forward to having you back soon.
I hope everybody learned something. Good to see everyone. Have a good rest of the day.
Thank you.